Hey, what's up YouTube? How you doing? Do you experience any creaking, cracking, snapping, popping, clicking in your head, shoulders, knees and toes? When you get out of your chair, when you get out of your bed, when you go for a walk? Does it sound like a bowl of Kellogg's Rice Krispies? Well, that's what I'll be going through today, the phenomenon of joint noises, otherwise known as crepitus, and whether or not you should be concerned about it. So, to start off, what is commonly believed about joint noises? In a 2017 qualitative research paper, individuals with knee crepitus or joint noises were asked to report their beliefs about the noise. They took a group of people that had a high prevalence of joint noise in the knee, and after tallying up their answers, they arranged them in order of beliefs that were the most common amongst the group, and these were the results. So, in general, they thought the noises signified degeneration and premature aging. It made them feel old. They thought of it as wear and tear. And in general, it led to less activity and fear-avoidant behavior in an attempt to avoid the noise. What this tells us, and even though this research paper did not have a large sample size whatsoever, but it correlates very, very nicely with what I've commonly experienced when I'm dealing with patients and just ordinary people, and even healthy individuals with no pain, is that those that experience joint noises often associate them with a negative connotation. But actually, no research has demonstrated a definitive link between joint noises and pathology. And by the way, what we're talking about here is what we call physiological noise, which is a natural noise that occurs within the joint when you move, and a joint noise that is not associated with injury. So if you snap, crackle, click, pop, clunk, creak, or grate, and yes, by the way, these are all descriptors that are used to categorize or identify different types of joint noises. But anyway, if any of these occur with the absence of pain and swelling, you shouldn't be concerned, and it is a natural physiological noise that is not harmful. Now, pathological noise, on the other hand, which is, for an example, a noise that is associated with rapid movement of a joint and occurs with subsequent pain or swelling, which is often indicative of tissue damage. Like a basketball player who is running, jumping, and cutting from left to right, who hears a sudden pop when he's pivoting or twisting, we are likely to think that that's an ACL ligament tear. Or he decelerates after sprinting, followed by rapid dorsiflexion of the ankle, followed by a pop and an inability to weight bear afterwards. We're thinking that it's most likely an Achilles tendon rupture, especially in both cases if they are followed by profuse swelling and pain. Now, these cases are very extreme, once-off, high-velocity movements that don't necessarily occur repetitively. What I'm talking about with physiological noise is, for an example, you go to the gym, you want to do some lateral raises, and every time you lift your arm up, your shoulder does a little bit of a click. Or every time you want to get up from bed, you hear a little clack in the ankle. Or every time you bend down to go into a deep squat, you hear some type of grating or creaking in the knee. These are physiological noises that shouldn't be of any concern. So here's the thing. In certain cases, joint noises are more common in osteoarthritis, patellofemoral knee pain, and temporomandibular joint dysfunction or jaw pain. When we look at the data, it shows that people who have these pathologies will present with a higher prevalence of crepitus or joint noises. If you have these conditions, you're more likely to have joint noises than somebody who doesn't. But it doesn't mean that they're harmful. A very large percentage of asymptomatic individuals present with joint crepitus. Almost everybody has some form of joint crepitus with no pain. But also, in individuals with pathology, the presence of joint noises was not associated with higher levels of pain, disability, or dysfunction. So those who had pathology and crepitus, compared to those who had pathology and no associated crepitus, were not any worse off. And even though joint noises aren't extensively studied, we know from some of the data that is out there that you aren't more likely to develop a pathology like arthritis or increased chances of having pain, disability, or dysfunction. So when clinicians and health influencers spread negative, erroneous information surrounding joint noises, it may cause catastrophization within these individuals, leading to a negative cycle about fear of wear and tear and reduced activity. Catastrophization basically means an increased hypervigilance and awareness towards that particular problem, with negative associations, which can often cause increased sensitivity surrounding the issue. And where there is catastrophization, there is a higher likelihood for you to perceive a painful experience and negative associations with movement, and therefore try to avoid movement or become fearful of it, which can actually cause even more negative outcomes. So if you don't move because you have this mindset that joint noises are harmful, that can potentially even worsen symptoms, because a reduced activity can lead to a sedentary lifestyle and cause weakness, which we know is more likely to increase your risk of painful musculoskeletal conditions. Therefore, it's important to explore where patients derive their health beliefs about crepitus and how it affects their behavior, because oftentimes these beliefs come from clinicians and coaches who have outdated understandings about the physiological processes that occur within joint crepitus. And they don't understand that the way that they use their words can significantly affect how a patient responds. In most cases, you do not need to reduce your level of physical activity because of noisy joints. We are noisy creatures. We fart, we burp, we shout, we sneeze, we sniff, we cough, our stomachs gurgle, our lungs wheeze, and our joints click. Thank you for watching. Let me know what you think, and if you have any other questions or concerns or problems or ideas, and I don't know, whatever the case, just let me know if you enjoyed. Thank you very much for watching. This is Bradley Cato, and I'll see you in the next one. Peace. How's it, everyone? You like my new setup? How's that for production quality? You like that? Hey? Yeah. No. Just let me know, Steven. Okay. Just, Steven, let me know if you like this new setup of mine. Check, I'm controlling it from my phone. It's very fancy. Because I know Steven's the only one I know that watches my videos. So Steven, if you're there, let me know if you like it. But if you're not Steven and you're watching this video right now, just let me know. Like, hit me up in the comments down below. I'm not Steven. I'm watching this video right now. And then I'll know that, you know, someone other than Steven watches this video, watches these videos. Anyway, so today we're talking about creaking, cracking, popping, snapping, clicking of the shoulders, knees, head, and toes. So when you get up from your chair, do you experience a phenomenon that is familiar to a bowl of Kellogg rice flake Krispies? God damn it. Okay, I think I'm going to restart this video.